You are watching the DocTalk show.
As mentioned, if malaria is not treated at the early stages, it can actually get into severe malaria with complications. And for people also who have not lived in places that have high malaria burden and come from places that have low malaria burden, traveling to a place that has a high malaria burden, you could get complications. So we normally hear of complications like cerebral malaria. That child has cerebral malaria, that he develops cerebral malaria. This is when the malaria parasite goes into the brain and affects the brain system and how the brain functions. You could get reduced levels of consciousness. Someone is awake, not awake, is in coma, is not in coma, they don't understand what they're saying, or actually could take you into coma.
Absolutely.
And for this can have long-term effects. Someone can get cerebral malaria, and with time they cannot actually fully function as a human being as they were with the same quality of life after getting cerebral malaria.
That's right. That's
So
right.
we also have things like anemia.
Yes, that's right.
Yes.
And because you said that the parasites actually attack the blood cells, and in particular they attack the red blood cells. So what happens is that as they are doing that, they also cause the red blood cells to die off. And so you actually reduce the number of red blood cells you have, and as a result you have malaria, or rather you have anemia. The other thing that happens while you're at it is that you can also develop jaundice. What's the yellowing of the eyes that people usually see, and sometimes you associate it maybe with another disease, but actually it could simply be that you're having a very severe form of malaria. And as it breaks down, it goes all the way into the kidneys, and it gives you very dark colored urine, which also will later on give you complications in the kidneys. So one of those, yes.
Yes, so in addition, yes, the anemia comes because during the maturation phase of the parasites, they live within the red blood cells, and these cells are what give the color of the blood red.
Yeah.
So when the cells burst because the parasites are mature, that process of destroying the red cells is what causes anemia. Anemia is basically very low amounts of blood in the body. So another complication it results in is difficulty in breathing.
True.
Which is a very, very severe form of, it's a very severe complication. It arises because the process, the malaria, the parasites can congest into the lungs and cause local inflammation, a process which is called acute pulmonary edema. Okay, that means there's a lot of inflammation, there's a lot of injury in the lung tissue, and it causes fluid to accumulate, and the person they cannot breathe. Okay, it's almost similar to a pneumonia. All right, so it can either cause that pulmonary edema, or it can cause what they call respiratory distress syndrome.
Like what we see in babies.
Very, very, yes. They
they're
can't
having
breathe.
very
They
labored breathing.
difficult.
They even require oxygen because the lungs are so full of fluid and they're damaged, badly damaged, that they require some extra support.
You're right, because even parents, the baby comes in with malaria, they tell them that the baby has malaria, and they say your child needs oxygen, and they can't believe that a baby, just a child with malaria, requires oxygen.
Right.
It is
But
so true, but it's because of that difficulty in breathing. The lungs cannot function as normally
As they're
because
supposed
they're
to.
destroyed.
As to be.
So they need that extra
Right,
support.
and it can be pretty bad too, because we know that sometimes we actually have to breathe for them because the level of destruction is so much at that time that the lungs can barely function at that time. So it stops being from just mild malaria to a point where you're taking somebody to the ICU.
True.
And you know, yes,
the intubation.
yes,
and
so that you can
support.
breathe for a
You're
person.
very right. We also we could have a drop in blood sugar levels.
Yes.
Most people know high blood sugar and diabetes, but malaria can cause your blood sugars to
To
go
actually
low.
go very
And
low.
that is where you see people start sweating. It can actually lead to immediate death.
Yes,
Yeah.
low blood sugar is a very, very dangerous complication, whether due to malaria, due to anything
something
else.
else.
Because your brain, the body requires an energy source to work. It is like the fuel for the car. So when the fuel runs out, the car
That's
stops moving. So the sugar is like the fuel for the body, for the brain. So when the sugar levels go down, and they go down because the parasites consume a lot of sugar. They consume the body's own sugar, and in addition, the illness itself, because the body's temperature is very hot, and so many systems are running very fast. All that drives the body sugars to very, very low levels and can result in death, because the brain
requires sugar to function,
Yes.
which is the same thing that happens with blood pressure. We know that many a time our blood pressure, for you to say you're sick, your heart is sick, and blood pressure levels are normally high. But malaria incidentally drops your blood pressure.
That's true.
Which is also dangerous. Like we're saying, high blood sugars can be managed easily, and low blood sugars are dangerous. But even low blood pressure is dangerous.
It's equally dangerous. That's very right. So at that point, of course, the challenge is that now you also have to start supporting the body's circulatory system, because as long as the blood pressure is that low, you're not able to maintain the normal function of the other organs. So you're starting to struggle with providing enough blood to the kidneys, providing enough blood to the brain. And you must remember that all of these complications are not happening in isolation. Some of them happen all at once.
At the same time.
So you're having a cerebral malaria, you have very low blood sugars, then you have a very low blood pressure. So all of these tend to happen pretty much at the same time. And it's not just that. You can have other things, because remember we said that the parasites break down the red blood cells, but then as a result, you can also have the other cells called platelets that help with the clotting system.
To clot.
Right. Those can also get used up, and so somebody starts bleeding all of a sudden, and then you have a bleeding complication. And so you come from having just malaria to having even bleeding complications at the end of it.
Okay.
I'm sure, plus also like what happens we also know that children, normally when they get a very high fever, some will start convulsing.
Yes.
Will start getting fits. A child who has never had epilepsy suddenly starts getting seizures because of the very high temperature, because the malaria parasites have also affected the brain. So these complications can actually be very devastating
Yes,
to parents.
we can see it can go from a non-severe to a very severe, affecting nearly all the organs.
All
of
the
body.
organs, right.
Another organ to worry about is the kidney.
Absolutely.
Right, because the kidney is a very essential organ for the body. It helps to filter out all the wastes from the body, and it comes out as urine. So because the malaria, when it causes the very low blood pressure, this blood pressure is what gives the organs their food, their nutrients. It drives the blood into
the organs for them to function.
So when you have very low blood pressure, it means the organs are kind of starving. All right, and one of the organs that are really, really affected by blood pressure going very low are the kidneys. So when the kidneys start shut down, then you're going into really, really dangerous waters now.
Right.
And as we can see, malaria can actually cause what we call multiple organ failure.
Yes.
We start with a simple malaria.
Starts going wrong.
You don't get it treated, and suddenly things
You're
are just
affecting the
going.
brain,
Yes.
you're affecting the kidneys, you're affecting the blood.
The breathing,
Yes.
so the lungs, we have said that we can get the lungs congested and all that. So malaria complications can actually be very severe. We are telling people that once you get malaria, they need to get it tested and treated early. So what testing mechanisms do we have in Uganda, and what can people access for them to be diagnosed and treated on time?
Right. So currently, thankfully, technology has come pretty far. So the first things that were present were you'd have to take a blood sample, and you'd have to take it to a lab, and somebody would have to look at that sample and would actually have to look at the microscope, under the microscope, and see the parasites themselves, which is still what we call the gold standard of treatment, or rather of diagnosis. So that still happens. But thankfully, though, there is what we call a rapid diagnostic test. So what happens is we just take a bit of a prick from your finger, put a sample on a small plastic slide, right, and it reads it in maybe 2 minutes or less, and you can tell whether you have malaria. It in and of itself is not an end. Ideally, we should be able to come and see how many parasites are we dealing with, in that amount of blood, so that we can say, are we dealing with a severe malaria, or is it somebody who we think the malaria is not very severe and perhaps they may not. They may do well with maybe oral medication. So just
and
medication
that's where
they
we
take.
say someone has scanty. When we hear that we have scanty or malaria plus, or they phone with a malaria plus.
Yes.
So now that reflects the number of parasites
that is so
in the blood.
within the blood film. That's what the plus or the plus means. So when you have very many pluses, that's just another problem, because it means the parasite burden in the blood
is very high.
Very
Yes.
high.
So Dr. Darius, could you also tell us, does everyone qualify to be screened and tested for malaria? We have people that really we must not miss while testing for malaria.
So there are, like we said, there are some risk groups, people who are particularly prone to malaria, like they can get very, very severe illnesses. So these people should have the focus. So patients like the pregnant mothers, because the malaria is very, very severe, tends to be severe in pregnancy and can result in loss of both the mother and the baby. So such patients, the pregnant mothers, should always have routine malaria screening during the antenatal visits.
And that's why we insist on malaria screening.
They should always go for antenatal screening to check for malaria. Whenever they get a fever, they should always go, and a malaria test is done on them. In addition, I think because it is so common in our setting, you would say any person who has a fever, whether it is a child, whether it's an adult, or it's a muzee, an old person, as long as you get a fever, because fever is a classic presentation of the malaria. So every person should at least get a test for malaria, the blood screen.
But also have people like sicklers.
Yes, and sicklers, it's particularly important for them.
These are children with sickle
cell disease. And you know that already their blood cells, the way their blood cells are, they're slightly abnormal. They don't function the same way as for people without sickle cell. And so when they do get malaria, they tend to get very severe forms of malaria. One, because already the blood that is normal is destroyed very fast, and then you have certainly the abnormal blood that they will have. So that is a very important category of people, particularly of children, that we must always make sure that if they have a fever, it must be tested and make sure that we're not dealing with a malaria, or if we are, it is treated early enough. And then certainly, like you said, children under 5, and this is vitally important because they're the ones who die the easiest. We know that in our country, malaria kills under 5s more than possibly any other. So it's very important that any child with a fever, first thing you think about is we need to make sure that this child either has malaria and we treat it early, or does not have malaria and we treat it for something else.
Yes.
And the tests are very sensitive. So whether it's that rapid test, the strip test, or it is using a microscope, they're very, very sensitive. So it means the person running the test can easily detect the malaria parasite and institute treatment.
And we are lucky that we actually have these tests readily available in Uganda.
Yes,
they are.
We have had cases of people travel from abroad and go back, and when they get sick, like you said, you don't get malaria, the mosquito bite today and get malaria immediately, and they cannot access the testing. But we are very lucky that within our setting, we are able to access the malaria testing. But we also have special groups like people whose immunity has come down, like people who have HIV, people who have diabetes, people with cancer, people whose immunity is already low need to be tested for malaria and treated as soon as possible.
Yes.
Now that we've discussed the complications of malaria and how to test it and the special groups that need to be tested, when we come back, we shall look at how malaria can be treated and then how to prevent malaria, because we don't want to talk about it like you must get malaria and you cannot prevent it. So once we are back, we shall discuss the treatment and prevention of malaria.
You are watching the DocTalk Show.